Hello, I am Dr. Oana, a physician with clinical experience, an expert in preventive health, and a practitioner with over 20 years of experience in complementary therapies, functional regulation technologies, and bioenergetic assessments. In all these years, I have noticed one clear thing. Many people have symptoms, but the diagnosis is still not found. Many people have good test results but have various symptoms. Many people take chronic treatments but still do not feel well. That is why we have integrated into our activity one of the most interesting modern services available today, Remote Biofeedback Assessment and Therapy Session, a non-invasive personalized approach focused on functional regulation, balancing, and monitoring. What is remote biofeedback? Biofeedback, in a broad sense, represents the use of physiological signals to assess and influence the self-regulation of the body. There are numerous validated forms of biofeedback used in medicine and psychology: heart rate variability, skin conductance, or EEG. Meta-analyses and studies published in databases such as PubMed have shown benefits in stress, anxiety, hypertension, chronic pain, or autonomic regulation. Relevant scientific examples: heart rate variability for stress and anxiety. Multiple PubMed reviews indicate improvement in the regulation of the autonomic nervous system. Biofeedback for chronic pain conditions, used as a complementary treatment for migraines, muscle tension, fibromyalgia. Neurofeedback, EEG biofeedback, researched in ADHD, anxiety, and cognitive optimization. These data support the central idea: the body responds when it receives correct feedback and functional stimulation. Where does the idea of remote approach come from? Remote monitoring and support technologies have been rapidly developed in the aerospace field, telemedicine, and applications for isolated environments, including programs associated with NASA. In space, distance necessitates remote solutions. Today, the same principle is used civilly: remote data, remote interpretation, remote support. Who is it addressed to? Individuals with symptoms without a clear response: fatigue, stress, insomnia, anxiety, lack of energy, difficulty concentrating. Individuals seeking prevention, periodic monitoring, lifestyle optimization, nervous and emotional balance. Patients with chronic pathologies, as integrated complementary support alongside treating physicians and classic investigations for monitoring. What is needed for programming? In our practice, we use patient data, first and last name, identification data required for administrative purposes, a recent photograph sent electronically, the history of symptoms, and existing investigations. The photograph is used as a working element within the internal software of the session. How does the meeting proceed concretely? Average duration, approximately 2 hours or up to 2.5 hours in complex cases. The process involves evaluation is carried out during each session, plus therapy. Comparative patterns and functional priorities are generated in the device's software. Identification of dominant imbalances. Which system seems overburdened? For example, nervous, digestive, hormonal, from an energetic and functional perspective. Running energy balancing protocols. Automated programs are used for functional support. Re-evaluation. We monitor how the body responds during the session. Feedback and clinical status. Next strategy. What we recommend afterwards: monitoring, repeated sessions, nutrition, lifestyle, complementary support depending on the case. Why do people choose this service? Because many say, I don't feel well, but the cause can be found. Or, I have chronic pathologies, yet I feel exhausted, tired, and it seems that the treatment already administered is no longer effective. Biofeedback targets exactly this area, identifying triggering energetic causes, functionality, adaptation to stress, energetic balancing, evaluation and correction of chakras, measurement and correction of aura, emotional balancing, identification of trauma patterns from the subconscious, and balancing. Theoretical benchmarks frequently used in the field: vibrational medicine, a well-known work about the relationship between biology, energy, and complementary health models. In science, it is well known that cells emit electromagnetic signals, tissues communicate bioelectrically, the heart and brain produce measurable fields, and stress alters physiological parameters. What do patients say after sessions? They more frequently report a state of calm, more restful sleep, mental clarity, reduced inner tension, increased energy. Important clarification: this service has a complementary role and does not replace traditional medical consultation, recommended tests, treatment prescribed by the attending physician. We work integratively, using a protocol registered by us, recognized and appreciated even in national and international specialty salons. My message to you: the body speaks before it screams. If we listen to it in time, we can prevent a lot of suffering. If you want to make an appointment, write to us, Biofeedback, and our team will send you all the details. Subscribe to our channel for information on modern health, prevention, and complementary technologies. I am Dr. Awana, and I look forward to seeing you if you believe that your health deserves your attention.